Thank you. Good morning. I'll be talking about ambulatory surgical centers, and I hope I'll be setting the stage for Dr. Schultz. So, various terms used to describe this: day case surgery, day care surgery, same-day surgery, come-and-go surgery. So the definition is the original concept of the day surgery was the admission and discharge of a patient for a specific procedure within 12 hours of working day. Day surgery is a pathway and it's not a procedure. And day care surgery has been defined by the Royal College of Surgeons as when the surgical day case patient is admitted for investigations or operation on a planned non-resident basis and who nonetheless requires facilities for recovery. So that pretty much defines the ambulatory center definition. There's something called a 23-hour stay policy, which basically means that any patient who stays up to 23 hours and 59 minutes can still be characterized as a day care patient. And 23-hour stay is actually determined by the day unit staff and is based on the need of individual patients and the procedure that they choose, and in order to ensure their safety. So something called fast-track inpatient surgery. Fast-track surgery involves the use of a coordinated and multidisciplinary perioperative care. The plan is to reduce complications in these cases, so we choose surgeries which fit into this category, facilitate earlier discharge from the hospital, and faster recovery and faster return to daily activities after this elective surgery. Often they don't even get to know who the masked man was. Why daycare surgery? Because of the rising healthcare costs, emphasis on evidence-based practice, and rising patient expectations. The history this began as early as in the beginning of 20th century by James Nicol, a Glasgow surgeon. He was doing this in children in 1903, and Ralph Waters from Iowa, USA, had his own clinic with downtown anesthesia clinic. So the current scenario in India, exact data is unavailable, but all specialties combined, it constitutes about 15% of elective surgical procedures. Ophthalmology, as we know, has become more day care in recent times. Objectives of ambulatory surgery is to reduce waiting time for elective surgery so that the patients don't have to make preparations for days to come to the hospital, to reduce inpatient admissions so the hospital beds are free for patients who require a stay, and to make surgery convenient and comfortable for the patient. Like we say in ophthalmology, you can have breakfast, come and have lunch at home. To reduce disruption of personal lives and to reduce hospital-acquired infections. To encourage early recovery and mobilization in a home environment with the family, and to reduce cost of surgery. Advantages of ambulatory surgery: patient has separate advantages. This is a patient-centered approach. Patient recovers in familiar environment, reduces the complications of post-op period, reduces cost, and return to daily living. Hospital advantages and physician advantages: increase bed availability for operations that require inpatients. Hospital can grow inpatient services. Outpatient center has great efficiency and cost effectiveness, and healthcare costs reduces 25 to 75%. Disadvantages: the need for a responsible person to see the post-op care at home for the first 24 to 48 hours. Restriction of day case to senior staff when it comes to other types of operations. Extra work for general practitioner in post-op period. Patients often give us a call and ask for advice or treatment on the phone. And cost effectiveness of the unit is reduced when less complex cases are dealt with on a day basis. So you can have a surgical OPD clinic when investigation is done, have the patient at the OT day, the surgery, the recovery room, ward, and then home. Or often straight from the recovery room home. This is various ways how the flowchart works at the hospitals. So there are different types of daycare surgeries. It could be hospital integrated, hospital autonomous, hospital satellite, and freestanding. Each have their own properties. I'm sure Dr. Schultz will be covering these. And infrastructure plays a big role in daycare. It should be located in an integrated setup. There should be existing operation theaters there, dedicated operation theaters unit, or freestanding dedicated ambulatory care facility. Various facilities will be required. Staffing should also be of the same interest. Selection of the patient for this and what procedure we do is very important. And various barriers. There's failure to recognize daycare surgery as a priority by the clinician or the patient's attitude, lack of financial incentives, lack of specialized facilities, poor management and organization of outpatient unit. Often the various problems we face are lack of awareness in the patient population that this particular surgery is actually a daycare surgery and they don't have to take out so much time. Poor communication and transport, poor facilities for proper training of doctors in daycare surgery, and sidelining the surgical, and often in the beginning insurance played its role. Thank you.